I'm Tony Hagen with Managed Healthcare Executive. Today we're speaking with Tom Newcomer. He's Head of Market Access US for Samsung Bioepis. We're speaking about Hadlima, an adalimumab biosimilar in low concentration and high concentration formula, which will be coming on the US market in 2023. Tell us about the impact on pricing of so many biosimilars coming into the market. This has been a concern that has come out in the Inflation Reduction Act. Industry has been concerned, but that's a separate issue. What do you think, particularly with 7 or more adalimumab competitors, what'll happen with pricing?
Oh, Tony, we definitely recognize that pricing and cost is always going to be probably one of the central questions about a product before it comes to market. It's something that we're probably routinely asked in every discussion. I'm sure our commercial partners are asked all the time in every discussion they have. Unfortunately, anything prior to launch with pricing is proprietary, so there's not a lot of information out there at this point in time. What we do know and do expect is to work with our commercial partners Organon in our external stakeholders to ensure that there is a robust pricing strategy in place and a reimbursement model in place specifically for Hadlima that brings benefits to the market.
And of course, you're already established with something like approvals in 9 different countries for adalimumab. So you're nicely balanced out there. I don't know whether you can tell us anything about the success of your adalimumab product overseas.
Yeah, I think regarding overseas, when I look at the markets over there and what I take away, especially sitting here in the US, what I'd like to think about is the product's already out there in 27 different countries right now. It has experience. I think that is something that is a benefit for Hadlima, that we can see 3 years of post-marketing experience from all the patients in Europe. What we have learned and what I try to take into what could be drawn into the US market from a learning point of view or expectation point of view is through the launch of Hadlima since 2018 in a lot of those markets, especially going through the COVID pandemic, there's never been any supply shortages. The supply continuity has been steady with Hadlima throughout that entire time. So those are the learnings that I like to take from Hadlima across the world when I look at how it's done the last couple of years and when I look at what could be coming here into the United States.
And just as a final thought on that, I realize that pricing structures and regulatory systems are very different in other countries versus here, and perhaps the average price paid for adalimumab is much lower overseas than in the United States.
I'm sure there's probably definitely varying pricing structures right through all 27 of those markets for sure.